Hi everyone, here I am back with new topic, that is Aushadhi Matra Nirdharana, means Posology in children. Posology nothing but dividing the dose of a medicine. In my last topic what we saw? We saw the pattern of the medicine, in which disease, in which condition of disease, how the medicine should be given for a children, right? That was Samanya Chikitsa Siddhanta, means general principles of treatment, how we should treat children. And about this topic is the next condition, that is how we should decide the dose of a medicine for a children. We will see this dose of a medicine to a children, how we should divide the dose of a children medicine to the children in this topic. But for students it's okay, rather they will, after this they will learn and they will get experience how to divide the doses. But for rest people who are seeing my video, it may be my friends or any other parents who are seeing this video for the treatment of a children, please don't depend fully on this video for dividing the dose of a children, giving the dose of a medicine for your children's. Your children best guide is who? Their own pediatrician, right? Because about your children or about your baby, perfectly only his pediatrician or her pediatrician will be knowing what to give, how much to give and when to give. These all it may be any videos or any Google matter, whichever you see, just for your knowledge in a confusion, but don't depend fully on a internet to decide the dose or decide the medicine for your children's ill health. Okay, so let's start the topic. Coming for students, yeah, you can refer this and you can follow the ideas whichever I give for your dividing the dose of a medicine. And for theory purpose, for exam purpose, you can study these slides thoroughly and you can write exam, and later by keeping these points in our mind, you should get experience and you should follow the points to divide the dose of a medicine in children. Okay, so the dose of a drug depends on, means whatever we decide the medicine in last Samanya Chikitsa Siddhanta, we saw how we should prescribe a medicine, how we should decide which medicine should be given for which condition, right? After diagnosis, that is correct diagnosis of a disease, we will decide which medicine should be given. Okay, after deciding the medicine, next point is how much should be given, right? This medicine how much should be given for the person, because according to different kind of diseases, according to different stages of diseases and different ages of a patient, the medicine's dosage differs, right? So these all points depends how we should we should divide the dose of a drug. That is the aim of the treatment. The aim of the treatment means mainly how you are giving, that is whether Shodhana or Shamana or Samana Aushadhis or Paschat Karma, Purva Karma, according to the condition of a disease, you will divide the dose. Okay, next is Kalpana. Kalpana means therapeutic form, that is the procedure, how the procedure you are following, maybe oral medicines or Panchakarma procedures or any other procedures which you are giving for a disease or a patient. Next is age of the patient. As I said, age of the patient or a child is the main point here, because according to the age of a children only we will divide the dose, especially in modern, coming to the modern point, there they will divide the dose specially on the age of a children and weight of a children, right? Because if you give high dose of a medicine for a small children, it will get side effects or it will get allergies for a children due to high dose. So age of the patient or a children is main here. Then the nature of the drug used. Why the nature of the drug used? Because if you are the using medicine is of Tikshna character, Tikshna nature, then it should be given in small quantity, right? If you are giving Madhura or Mrudu Swabhava or nature's medicine, it can be given little high, nothing to worry. Okay, Next point is nature of disease. Why the nature of disease here? Because the disease condition will be in different, maybe mild, moderate and severe, right? In mild form of disease, if you give high dose, then again it will be side effect for a body. Or in high nature, that is chronic nature of a disease, if you give mild dose of medicine, then it won't work anything for a disease, because the quantity of or condition of a disease will be more than medicine, right? So we will observe the nature of a disease, then we will decide the dose of a drug. Then last point is bala of the patient. This point is very important point, because according to the bala of a child only you should give medicine. Not only child, it may be any person. According to bala, according to their strength only, you should divide the dose of a drug which should be prescribed. Okay, keep these points in mind. Next, coming to our Ayurveda Acharyas, these three main Acharyas explained how we should divide the dose of a drug according to their own view. Posology according to different Acharyas. The who all Acharyas? Charaka, Sushruta and Kashyapa. We will see how they divide the dose of a drug for the children. First one is Acharya Charaka. How he divides the dose of a drug? According to Acharya Charaka, he explained as dosha, dhatu and mala of children remains in low potency when compared to that of adults. Hence, the quantity of a medicine as well as frequency of the dose should be less proportionately. Means, as we all know, in children compared to adults, all dosha, dhatu, mala will be in less quantity in children compared to adults, right? So Charaka said, as they will be low, the frequency of the dose of a medicine should also be in low quantity, according to Charaka. Whereas Acharya Sushruta explained in Sharirasthana 10th chapter 43rd shloka and 35th chapter 30th shloka, you can refer. Whereas our Sushruta divided the age of a children in three categories, right? That is Kshirapa, Kshira Annada and Annada. The dose of a medicine also he said in the same way. As for Kshirapa, that is up to the 1 year of age, he explained 1 pinchful of medicine. And for Kshira Annada, that is 1 to 2 years, equal to the seed of Badari, Kolasti Matra. Badari means nothing but Borehannu. In Kannada we will say Borehannu. That equal to that of quantity of Badari, seed of Badari. The seed of Badari, that is Borehannu's seed. And in Annada, that is above 2 years, equal to Badari Phala, that is Kola Samittam. Whereas for 1 to 2 years, the seed of inner seed, that is Bija of a Badari, and for above 2 years, equal to the Badari Phala, the fruit, Badari fruit, equal to that of quantity we can give for the children, the dose of a drug according to Sushruta. Whereas he added some more points like the dose should be increased gradually during growing age. After 2 years he said Badari Phala Matra, right? As the child grows, we should increase the dose of a medicine, and after till up to which age? Up to 70 years. But after the age of 70 years, dose should be as that of child. Till 70 years we should increase gradually, and above 70 years again how we should give the medicine? Equal to the quantity of children medicine we should give the dose of a drug in a patient or a person who will come to us as a complaint, by taking complaint according to Sushruta. Whereas next Acharya is Acharya Kashyapa, who is the father of Kaumara Bhrutya, that is pediatrics, Ayurvedic pediatrics. He explained in Kashyapa Samhita Sutrasthana 18th chapter 12th and 13th shloka. This shloka must and you should write in an exam if they ask the dosage of a medicine, Aushadhi Matra Nirdharana. If they ask, you should write the shloka compulsorily. As shloka stated as Vidanga Phala Matram tu Jata Matrasya Dehinaha Besajam Madhusarpibhyam Matiman Upakalpayet वर्धमानस्य तु शिशोः मासे मासे विवर्धयेत् अथ आम्लकमात्रं तु परं विद्वान् न वर्धयेत्. Means Kashyapa explained as the dosage of the children should be given as Kashyapa is only author or Acharya who stated the administration of medicine to Jatamatra also. Who is Jatamatra? Newly born baby. Immediately after birth, the baby is known as Jatamatra, right? Only this author explained medicine for the administration of Jatamatra. For newborn child, drugs should be prescribed in a quantity of 1 vidanga with honey and ghrita in unequal quantities. In case of growing child, it should be increased gradually every month. The quantity of 1 amlaka is the maximum dose allowed. As the month wise, he explained, should be increased from 1 vidanga to maximum dose is 1 amlaka. Amlaka, nothing but amla phala. The quantity of amlaki matra is maximum dose for a children, explained by Kashyapa. Whereas for Jata matra 1 vidanga and the maximum dose is 1 amlaka phala matra. This vidanga and amlaka, how much quantity it will vary, I'll explain you. But as the Rashastra you studied before only in second year, I think you all know how much is 1 pala, how much is 1 aksham, 1 prasuta. This all quantities you know. I think if you all don't know, let me come to know in a comment section box, okay, so that I'll get clarified to explain you detailedly in my next videos. If you have any doubts, please try to comment for a video, so that I'll come to know which points you needed. Okay, in last slide we saw, according to different authors, different acharyas of our Ayurveda, how they divided the dose of a drugs, right? Coming for modern point, formulas to calculate children's dose. Some formulas they gave how we should divide the dose of a drug in a children. That is, according to Young's formula, these 3 formulas they gave for the division of a dosage of a drugs in children. That is, Young's formula, child dose is equal to adult dose into age by age plus 12. And coming for Cowling's rule, child dose is equal to adult dose into age plus 1 divided by 24. And Dilling's formula is child dose is equal to adult dose into age by 20. These all are the formulas to calculate the dose of a drug according to modern view. Please try to solve these formulas by keeping some age of a child or some dose of a child, so that you will get clear. If you have any doubts or if you are not getting how to calculate, let me know in a comment section box. I'll solve you one formula and I'll show you in a comment section box, okay. So coming for the different variety of medicines in Ayurveda, as we know, we have the different varieties of forms of medicines, right? It may be like Ghrita, Kashaya, Churna, Vati, Varti, Kalka, everything. In different forms we have medicines. But we can't give all medicines, all form of medicines in same quantity, right? Because the consistency may be, the ingredients may be, or the way of preparation may be different in different forms of medicine. So they gave the different way of dosages for different form of medicines. Like dose of Ghrita should be given for Jatamatra Kolasti Samittam up to 20 nights. From birth up to 20 nights Kolarda Samittam, up to 1 month Kola Samittam, and in second month it can be little more to Kola Matram, and in third month 2 kolam can be given, and in 4th month Shushka Amlaka Matra, and in 5th and 6th month Ardha Amlaka Matram can be given as a dose of Ghrita, and it is given till 6 months. Till 8th month we can give only Ardha Amlaka Matra, and after 8th month we can give 1/4 part of drugs, 1/4 part of main drugs we can give Ghrita Matra, that is Sneha Matra, and after 8 months as the baby will leave the exclusively breast milk, so we can go for direct water has a mixed with the drugs we can give. Okay, this is the dose of a drug, dose of a Ghrita can be given in a children. Next is dose of Churna. This is based on the aim of therapeutics, as the Churna is given according to the dose procedure, which aim of a procedure we are giving for the as a medicine. According to aim of a treatment, the dose of a drug is divided. As if we are giving Deepaniya drugs, then the dose is 1 pinch, and if we are giving the Jeevaniya drugs, double the quantity, nothing but 2 pinches we can give. And Samshamaniya drugs, if we are giving, then we can give 2 pinches. And for procedures of Vamana and Virechana, we can give half pinch of Churna. And remember, every Churna, the Anupana, not only Churna, for every medicine in Ayurveda we want Anupana. Anupana is nothing but vehicle through which we can give the medicine, because how you will give advice Churna, they can't have the Churna in mouth and they can't swallow, right? It should be given with mixing something like Anupana as vehicle. I'll explain you later. Usually in children we will give Churna as Anupana with honey. With honey as a Anupana we will give this Churna in a children. There are varieties of Anupana vehicles. I'll explain you later. Coming for dose of Kashaya, Kashaya type of medicine, how we can give. In Vata, Pitta, Kaphaharam, we can give 2 Prasutas. 2 Prasutam, nothing but how much quantity do you know? 1 Prasutra is equals to 192 grams, right? So you can multiply it and you can give. As I said before, this Prasuta, Pala, everything, you should go for the Shastra quantity which they explained there. If you are not getting, let me know. Okay, and in Jeevaniyam and Samshamana type of medicines, you should go for 4 Prasrutam. And in procedures like Vamana and Virechana, you can advise 3 Prasrutam of Kashaya in a treatment of a disease. Okay, next is dose of Kalka. In Kalka form of medicines, you can give for Deepaniya 1 Akshayam, and for Jeevaniyam 2 Aksham, and for procedures like Vamana and Virechana, you can go for of Aksham. This is dosage of Kalka in treatment of medicine. Okay, next is dose of Vasti. Vasti here nothing but the procedure, one of the Panchakarma procedure, you may be knowing, right? For that dose of the procedure of Vasti, we will use the medicine to insert in an anal region, right? The dose, how much you should insert, they gave the dosage of a medicine, like according to Charaka, till 1 year 1 pala. 1 pala means 16 grams. Okay, and increased by 1 pala every year, reaching a dose of 12 palas at year of 12 years. At the age of 12 years, it should be 12 palas. You should increase 1 pala for every year from 1 year. Okay, till 1 year you should give only 1 pala, and thereafter dose is increased by 2 palas every year. After 12 years, it should increase to 2 palas every year, and the adult dose, that is 24 palas at the age of 18 years. At the age of 18 years, how much will be the dosage of a medicine? 12 palas. 12 palas means 24 palas. At the age of 18 years, it should be 24 palas. 24 palas means 384 grams. It should be at the age of 18 years, and 12 palas is nothing but 192 grams at the age of 12 years. Okay, coming to last point, medicinal dosage as per currently existing units. As I explained till now, before we were giving our especially our Ayurvedic physicians were giving raw drug only, right? Raw drug only we were preparing by ourselves, like Churna, Kalka, everything, and we were giving, advising like 1 pala, 2 pala, everything. But in our Ayurveda also nowadays we have plenty of patent drugs, right, in our medicine. Like modern medicines, we have syrups also, we have vatis also, we have tablets also, everything we have. According to the patent drugs, according to currently existing units, our medicine dosage should be for Rasa Aushadhis 10 mg, that is milligrams to 250 mg per dose we can advise according to the age of a children, right. And Bhasmas 30 milligrams to 300 milligrams per dose we can advise. They gave the range 30 to 300 because again we will divide the dose according to the age of a children and bala of a children, right. So they gave the range. And Churnas 100 milligrams to 4 grams per dose. And Arka, Panaka, Kashaya, this all we can give 5 ml to 30 ml per dose according to age of a patient. And Asava, Arishta can be given 2.5 ml to 115 ml per dose we can advise. And Lehya means like Chawanprash, it will be. Those are of the dose of Asava and Arishta. How much is Asava and Arishta? 2.5 ml to 50 ml per dose is Asava Arishta's dose, right. Off of that, that is 1.5 ml to 7.5 ml per dose we can give Lehya. At the dose, these all are per dose we can advise this much according to the bala of a patient or according to the age of a patient we can divide and we can give. Okay, this was the topic about how to decide the dose of a drug in a children, right. That is Aushadha Matra Nirdharana, nothing but posology of a medicine in children. So if you are having any doubts, please let me know in a comment section box. If we start conversation, then only I'll come to know that the topic you are getting or not, right. And also if the conversation starts, the healthy relationship will start in a any matter, true, right. So if you have any doubts, please let me know in a comment section box. And also if you want any particular topics, then let me know the points which you want, so that I'll explain them freshly. And I mean starting whichever points you needed, I'll explain and I'll go for next topics later. Okay, thank you.